Last year I did an interview on Earn Your Leisure where I was the first guest to speak on entrepreneurship in the healthcare space. In that video, I talked about my experience in healthcare staffing and in home healthcare. At one point, it was clear that the two being very similar was creating some confusion. Since that interview, I continued to talk about my success in both businesses, and I still get asked, how do I start a nurse staffing home care company? Some sort of mashup between the two different types of healthcare companies that I'm in. This doesn't quite exist, so I'm setting the record straight. In today's video, I'm going to put this confusion to rest and clarify what healthcare staffing is and what home healthcare is. I'm going to discuss the difference between the two, how they are similar, how they are different, and who should start one of these businesses. I'm also going to discuss how I can help you get started. This is one of the videos that you absolutely have to watch to the end if you're thinking about entrepreneurship in healthcare. I started this channel to teach people how I approach my businesses. I mostly talk about real estate, and then I talk about some of my other businesses, as well as my passion for exploring the world and living a global lifestyle. If you want to earn money so that you can break free from your routine and start living your dreams, make sure that you like this video, subscribe, so you don't miss a thing. My name is Carl Pierre, and this is the NTP Life. Before we get started, I want to remind you that every week I put out a video. I follow up with a live Q&A to do a deep dive on the topic. This week, I'm hosting a public webinar where I talk about healthcare staffing and how you can easily get into this lucrative business with just a few $1,000s. I have a link down below and in the description, and I flagged it right in the comment section so that you could sign up or get reminders so you don't miss it. Now that you're clear on what's happening this week, let's define what is healthcare staffing. In healthcare staffing, your main objective is to bridge the gap in employees that an employer might need. So let's just say you're a hospital, skilled nursing facility, even a home healthcare agency, and you need a nurse. You've been looking to fill this position with an RN or an LPN, and you're just having a hard time. Such a hard time that you're willing to reach out to an external agency, like a healthcare staffing firm, to help you fill that position. Now, you may fill that position on a per diem basis, meaning that for whatever days you have available. This could even be maternity leave or just a basic call out. It could even be vacation coverage. You find that in skilled nursing facilities especially, there's like this spike in the summertime when all the nurses are traveling for vacation, kids are out of school, etc. They tend to be short. Also, you may find traveling assignments for hospitals, for instance, where hospitals are always short on RNs. They need RNs to maintain their staffing ratios, and they're willing to enter into these agreements with staffing companies to help them fill these shifts or these gaps that they have in their schedule. You may also see providers reaching out to staffing agencies for placement, okay? So there are placement companies or placement practices within staffing firms. So instead of it being a travel assignment that might be 13 or 26 weeks at a time, or a per diem assignment where you're just filling in that shift, you have providers and facilities reaching out to staffing firms to help them fill permanent shifts or permanent positions, and they're paying out a finder's fee or a headhunter's fee. So all that falls into that healthcare staffing realm. And what you need to really remember is that the healthcare staffing firm, their primary function is to be a recruiter, to vet and screen the type of staff that facilities and providers may need to fill their positions. Now, the way these healthcare staffing firms get paid is either going to be a finder's fee in the example of like when they're recruiting and placing on a permanent basis, they're going to get anywhere from 10 to 20%, sometimes more, sometimes less, depending on what you negotiate. Or they're going to get paid a fee for actually staffing this person. So this is a pre-negotiated hourly rate for that particular employee. And what they're going to do is make the spread or the gap between what the facility is paying them to provide this worker and what they're paying the worker. So let's just say they've contracted for $60 an hour for an RN, but they're paying their RNs $40 an hour. They're going to make the gross difference between that, which is $20 an hour, and that's before workers' comp and taxes, etc. But that's going to be their profit margin, the difference between what they're contracting for and what they're paying their employees to fill those staffing roles. You may be thinking, okay, so what is a home care agency or a home health care agency? Although both have the word agency in their description, there's a significant difference between the two. And the best way to remember why they're different is home care and home healthcare agencies provide direct care to patients in their homes. To further clarify this, I'm also going to explain the difference between home care and home health care. So the first thing I need to do is define what is a home care agency. Typically, a home care agency is a provider or a company that is functioning to provide home care or personal care for clients that might have a chronic or long-term need. Personal care is going to be assistance with activities of daily living. So this is bathing, brushing your teeth, preparing to go to dialysis, meal preparation, medication reminders. It's more a low-level sort of work, or if you want to kind of think of it in a way, it's kind of like babysitting a chronically ill person, right? And kind of filling in the gaps that they have and the things that they can't do on their own. Home care companies in some states are called home care companies regardless, just because the care is taking place in the home. Now, the real difference in the way that most professionals think about home care and how it differs from home health care is that home care focuses more on those basic needs, while home health care is more of a skilled service. Home health care is really addressing subacute or acute needs that a patient may have. What I mean by that is the patient is typically coming out of the hospital or has a new onset of disease that is meant to be treated over an episode. So these episodes could be singular episodes where it's just an injection of a single dose of, let's just say, birth control, right? We had one instance where a group home contacted us to just do a birth control injection that was supposed to be done once every 6 months, and we were called to do that. It could be as complex as wound care with IV antibiotic treatment or in-home chemotherapy. Once again, the takeaway is that home health care is meant to be a skilled service for a shorter duration of time, or a highly skilled service that should be provided in a hospital skilled nursing facility but can be provided at home, such as someone who's on a ventilator, who's receiving tube feeding. That might be someone who falls into the skilled care category but may be in that condition for a long term. Now, I don't want you to get confused that home care and home health care are the same thing. They sound very differently. I guess the best way of trying to separate the two is remembering that home care is non-skilled, typically day-to-day care, assistance with activities of daily living, while home health care is going to be more involved, more complex. Think of what would be happening in a hospital or a nursing home taking place in the home setting. And the reason why there's this push to home health care is because institutional care, both in the nursing facilities and in the hospitals, is far more expensive than sending an interim nurse or a nurse to the patient's home, or a physical therapist, etc., to that patient's home to administer the care there, right? You're not paying for the hospital bed, you're not paying for all the overhead that's associated with the hospital, you're paying just for the treatment that is required to help that person get healthy. Another key takeaway is that in almost every state in the United States, home care agencies as well as home health care agencies both need to be licensed. Again, you are functioning as the licensed provider. You are taking the responsibility. You are now regulated typically by the Department of Health. You tend to have an accreditation body involved. You have to be held to a standard. You're the one that's responsible for all the employees that are working in your organization. You're ultimately responsible with what happens to that patient. You are a licensed entity, no different than a skilled nursing facility, no different than a hospital. You're held to that standard when you're running a home care agency or a home health care agency, regardless of the skill level of your staff. Their thinking is that you're caring for people. You are the quote-unquote physician. You are the hospital. You are that skilled nursing facility, and you're the one that ultimately has to make the best decision and best practices for that patient. When you're looking at healthcare staffing, a healthcare staffing company doesn't have that same license requirement. In some states, you may have to register if you're employing nurses in certain situations, and then you'd have to kind of enroll as a nurse registry. But in most states, that's not required for what I discuss as the function of a healthcare staffing firm, more or less that middlemaning. Home healthcare and home care are licensed, highly regulated, parts of the industry. and they should be. Ultimately, that patient's care is in your hands. Now, if someone is staffing that company, that situation sort of changes, and I'll talk a little bit more about that. To summarize, a staffing agency or staffing firm is simply a middleman bringing employees and employers together. In this case, the employer is the healthcare provider. In home care, the agency takes care of the individual's needs, providing direct care to the patient at home rather than in a facility. If you're one of the clever ones, you might be thinking, can a staffing firm staff a home care agency to address their staffing shortages? And the answer is yes, without being directly responsible or regulated by the state. In this case, the home care agency is ultimately responsible for the patient. Now that you're clear, let's talk about who should pursue either of these businesses. Being that I've been in both sides of the business, healthcare staffing, as well as running home healthcare agencies or home care agencies, I kind of have a good sense of which industry group is best for what sort of person. So to start with, let's talk about home healthcare. Home healthcare is really good for the nurse or the skilled professional, whether they're physical therapy, speech therapy, nursing, respiratory therapy at times, occupational therapy as well. It's for that skilled professional who thinks, hey, I want to provide this service, and I feel that the way that other agencies are providing the service just is inadequate, or there's not enough resources. I really think home health care agencies are best suited for people who have worked in the industry, either on an administrative level or as the direct care provider, because there's a lot more nuances there. And if you're just someone who's in it for the money, it may be hard for you to get over the initial hurdle and figure all the nuances out. However, that doesn't mean that because you are not a healthcare professional or you haven't worked in healthcare at all, that you cannot succeed in home healthcare. There's been many stories where people who are completely external to the business have come in because a family member required care, they had difficulty finding the caregiver, and said, you know what, screw it, I'll just go about handling this myself, and I'll create the entity that I wish I had to help me with my mom, my child, etc. So I really have my bias, like I said, that it should be a healthcare professional to get the home healthcare agency started, but it really is not necessary. Now, when we're talking about healthcare staffing, I think it's really best suited for someone who has worked in human resources and recruiting, as well as nurses and other healthcare professionals who have worked within a staffing firm. And the reason why I believe that is that the biggest piece to this business, aside from landing your contracts, is finding adequate staff that can do the job and perform well, right? That's going to be your reputation. That's going to be where you make your money. So if you're someone who's worked in human resources, who's worked in recruiting, especially who's worked within healthcare, you'll know all of the requirements, how to go through, what are the recruitment channels, how to go through credentialing that person, ensuring that they're going to be compliant when you place them at a facility, and how to weed out the good from the bad, right? That's going to be innate to you because that's what you've been doing in your job, right? So if you're in human resources and healthcare, this might be one of the best paths for you. Now, the reason why I say it's great for the skilled professionals as well is because nurses go to school together, they work together, same thing with all the other professions. And you're going to have a network of friends and family typically that work within those lines of work. So those will be your first recruits, the first people to work with you to even help you build your business. So once again, when you're in the industry, you have a little more intimate knowledge. The learning curve is a little less. However, that doesn't exclude people who are completely outside. Let's just say you were working in human resources for any other company. You would be able to go through the application process, screening process, maintaining employee compliance. It would be easier for you to learn. And even if you're someone who's been completely outside of human resources, if you have good administrative skills, you know your way around a computer, you're good with people, I also think that healthcare staffing can be the choice for you. As promised at the top of this video, I said I'll explain how I can help you get started. Last month, I launched a course on healthcare staffing and have had dozens of people embark on their journey. I've included a link for that course down in the comment section, as I mentioned before, and I've also established a partnership with a company to assist anyone looking to get into home care and home health care. They could get you licensed in your state of choice, and then I could work with you after you're licensed to help you scale your business to over 7 figures in earnings. If you want more information about my course, join me live this Wednesday at 6 6:30 to learn how you could get involved in the course and how you could work with me. You could always shoot me an email at info@entplife.com to get updates about what I'm doing so that you could go out there and earn your own passive income. Once again, thank you for joining me here at ENTP Life, and I'll see you this Wednesday. Take care.